Okay, hello. Thanks for clicking on the link. My name's Dr. Jonathan Hill, and I'm the academic lead for this backup first contact web app that you're about to try out for us. So let me just tell you a little bit about it. Um, Firstly, this is a decision support tool designed for first contact clinicians treating back and neck pain patients. So it's not particularly designed for the rehab stage. It's designed for the very beginning, where you're trying to decide on a management plan for a patient and give them an initial care plan and maybe signpost them through to have physiotherapy or to have some painkillers or even be referred off for some imaging if that's necessary. Now, the tool has been developed by a big team of us. It's an EU funded project. And so, what we've really got to do is get this web app to work across 10, at least a minimum of 10 different European countries. If you're using an English version, you'll find English self-management resources. If you register as a German clinician, you'll find the self-management resources are now German appropriate self-management resources. So that changes according to your nationality. Um, what we are doing at the moment is just an early phase of testing. This is a completely standalone system. It doesn't integrate to routine medical records in any way at this stage, because what we're wanting is to get clinicians to try it out and give us a sense of the content and how appropriate this is for early decision making for back and neck pain patients. We're really pleased that you're prepared to have a go. You will find another video from me which gives you a walkthrough of the whole web app. But when you actually get started, you'll be given access to it in 3 levels. So in level 1, you choose some treatment options that are appropriate for this patient and produce their care plan. Once you've done that and given us some feedback about how well those particular web pages are working, and we ask for that on roughly 5 patients, and then we'll start asking you for that feedback. Once you've given that feedback, that will unlock the next stage. And in that stage, you get risk stratification and individualized prediction graphs for your patient. And then once you've given us some feedback on another 5 patients and you tell us what do you think of those web pages, you'll then unlock the last stage where you get to have some user statistics. So you can look at how does your decision making compare to other clinicians, either in your medical center or others in your country. And you can filter that by low, medium and high risk patients, by body region. There's a number of things that you'll be able to do to filter your statistics and look at. So I hope that overview is helpful, and just many thanks again for being part of this. We really appreciate it.